Hi everybody, Dr. Scott Taylor here from Southwest Spine and Rehab in Mesa, Arizona. I have Chelsea here to help demonstrate the flexion distraction technique. So Chelsea, we're going to start by having you lie down on your stomach for me. So now Chelsea has a lumbar spine, some complaints in her lumbar spine, and we've worked with her before. She also has a little bit of a disc injury going on. So flexion distraction technique is a great therapy. It's a great technique. What it's going to do is it's going to pull and distract the areas of the lumbar spine that we're trying to work on. Okay, so if you think about, maybe a peanut butter sandwich, we're going to use a basic analogy here. We have two pieces of bread with some peanut butter and jelly. What's happened for a lot of us is that peanut butter and jelly, which would be analogous to the disc, has been squished out and pushed and moved to the sides. What we're trying to do is move those two pieces of bread apart to help keep that material where it's supposed to be. Now, does a disc magically pop back in? No, it does not. But this helps that disc have the opportunity to heal itself from inside out. And this also helps to stretch and traction out the muscles, ligaments, and tendons of the spine to help provide some relief. Paired with the other appropriate care, we get some phenomenal, fantastic results. But with this technique, we utilize a special type of table, which I'll show you now. So there's this little button down here that I'm going to push. And so what we're going to do is we're going to turn on a little timer here, like that. And then I have a little pedal here that I'm going to turn on. Now the patient is going to slowly move up and down. Now Chelsea's younger and she's pretty darn healthy. She just has this little back issue. So as this table moves up and down, it's stretching and pulling this part of the spine apart. Now I am going to slow this down a little bit to more of a traditional speed here of a regular patient. So let's say you just came in and we determined that you have some discogenic pain or pain that's associated with a disc injury. And you can barely move. You can't get on a table very well and you can't rotate side to side and tolerate a traditional adjustment. This would be something more along the lines that you would probably see. So as this table goes down, we will palpate that area that we're wanting to work on. And as the table goes down, we're going to push the patient's, in her case, her L5 and her iliac crest at the top of the pelvis downward. It adds a lot more stretch just to that area. Now, most of us, when we want to stretch our low backs, this specific area is very difficult to stretch on our own. If we go and just try to touch our toes, most of it will feel it in our hamstrings and in our upper back. This area is very difficult to stretch, and that's why this technique works so good, especially for folks, osteoarthritis of the spine, lumbar spine pain just in general, but something called hyperlordosis. So our ladies that have had babies, the spine goes so far forward, baby comes out, get a new baby, but you get a spine that doesn't function right anymore. And so that's why these techniques can be so beneficial, and they feel really good even when you're in a lot of pain. So this is flexion distraction technique. There's a couple other things that we normally would do, some different stretches as that table goes down. We utilize that table and just stretch you apart like that. Now Chelsea's a lot smaller, so we don't need to put a lot of force into her. But I've had patients as big as 450 pounds where we literally are pushing with quite a bit of force to help traction and open that up. But that's how flexion distraction technique works, and that's why it works so very well. If you have any other questions, check on the other videos or drop us a line. Have an awesome day.